Welcome everyone. Just as a reminder, the format that we've now taken for these meetings is that we're trying to really invite guest speakers to present on topics that are relevant to us. Each topic is sponsored by a leadership table representative who provides a brief set of remarks to introduce the topic, its relevance, and why it's important for the community of practice. And then really we want to encourage everybody to ask questions, to really kind of engage in these really excellent discussions. And we're certainly very excited for the topic and speaker that has joined us today. So unless there's any questions on content or topic, what I will do is hand it over to Jenny to kind of give us that introduction and to introduce our speaker for the day. So over to you.
Okay, thank you. I'm very excited to have Danette here today to talk about sustainable pharmacy and healthcare. I think that it's a really great topic for us to dive into because there's so many opportunities here. But maybe I'll start off with a little bit of an intro for Danette. So Danette Beechinor has been the director for pharmacy at Sunnybrook since October 2018 and is now the co-director of precision diagnostics and therapeutics at Sunnybrook. She's also a co-chair of our Sunnybrook Clinical Operation Environmental Sustainability Working Group and has advanced a lot of our initiatives. So thank you, Danette, and I'm really excited to share some of the work that the group has led. But a little bit more about Danette. She started her pharmacy career in the Canadian Forces. She rose the rank of lieutenant commander and left the forces in 2002. She joined Sunnybrook to pursue an academic and clinical leadership role. Danette's held several leadership roles, including professional practice, a research resource pharmacist, and then a clinical manager at Trillium prior to joining Sunnybrook. So Danette is coming to us with lots and lots and lots of experience. So I'm very happy that she's here to share some of her insights on sustainable pharmacy. So maybe I'll pause here and pass it over to Danette to share some of the great work that her and her team are doing.
Okay. See here. Okay, am I still sharing the correct screen? I tested it a few moments ago, so it should still be correct. So thank you very much, Jenny, and to the Cascades Community of Practice for welcoming me here today. I wanted to talk about pharmacy leadership and greening healthcare, but I did try to ensure that I chose some things that that allowed us to or would acknowledge that it wouldn't all be pharmacists in the group, and that we would have some things in here that are reasonable ways of approaching greening healthcare, whether or not you actually work in a pharmacy. Okay, did the slide advance? It did? Okay, good. All right. You never know what other people are seeing. So conflicts of interest. So I want to declare that I have no conflicts of interest related to this presentation. The ideas presented are my own, except where I expressly reference that that they are not. Sorry, except where expressly referenced. So in terms of outline and objectives for today, so one of the things that as a clinical operations working group, we when we had our first few meetings, we really struggled a little bit with where do you start. So there's a lot of work to be done, and you want to select things that are impactful in order to gain some momentum to reduce hospital pharmacy or medication-related negative environmental impact. I want to talk about how we shared an awareness of specific, I want to share an awareness of specific examples where there are some easy choices that can make a difference, and then also talk about some of the projects that are a little bit harder, but you may still want to embark on those difficult projects. So even though it's hard, I guess you can do hard things, and that's important to remember as well. And then I want to talk about some of the things that we did very intentionally to drive engagement, and we did it using some very meaningful metrics, things that would mean something to the folks we would be working with. So when it comes to impact and sustainability, I think probably many of the pharmacists who are here today are involved in formulary related decisions. And so we started off with a very simple formulary related change. So we had a project idea. which was to remove desflurane from our formulary. And we wanted to have some metrics in terms of auditing this. So essentially, is it still on your formulary? Yes or no is a very easy audit metric. But then you have to ask yourself, is there any non-formulary use? Is it still being used somewhere in the organization, despite the fact that it's not on your drug formulary? When you look at the environmental impact of it, we gave it a score. So we developed this table that we have here as a scoring matrix. So we were trying to figure out how do we pick which projects to do. Lots of ideas came forward, and so we wanted to give things a score. So we gave it an environmental impact of 8 out of 10, and that's because the desflurane is so harmful to the environment, and it is uh, switching, even though our usage was low at Sunnybrook, was likely to have a very impactful result. And I will talk about that when I get to the using metrics that are meaningful to people. I'll actually give you a bit of a better idea why it got a score of 8. In terms of the clinical impact, we decided that 5 was neutral. Now, you could do a scoring system, decide like, oh, maybe 0 is neutral, 10 is really good, -10 is really bad. But we decided there would be no harm and no benefit, and that gives you a 5 in terms of clinical impact. Financial impact, so 5 was a positive impact. A 5 is neutral, 10 is positive, 0 is it's going to cost you money. There is a slight cost savings when you look at avoiding using desflurane and using other alternatives. And how easy would it be? So because it's a systems-based change, it's actually pretty easy to get desflurane off of the formulary. And once it's off, it's off. You'd have to go through a whole committee-related process to get it back on again. And if it's a systems-based change, we gave that a really high score because that meant that the change was going to stick. So this was the very first project that we did. It was, you would think, quite easy. I will say I have some thanks to the TAHSN groups regarding the scorecard they have for how green a hospital are you, because one of the items on that is desflurane off of your formulary. And we had a little bit of resistance initially because it was, well, we never use it, so we don't really need to take it off formulary. And then as soon as that became a scorecard item, it was off the formulary within a week. And then the question becomes, well, okay, so then we were a yes. We were, in terms of our audit metric, we've achieved that. It's no longer on formulary. We actually found, because we were auditing, that 1 year later, somebody had inadvertently purchased some. And so the expired desflurane in the operating room, there were 3 bottles or 6 bottles, something like that, and they expired and they got replaced. And so it's important to keep an eye on that. And so then we went back, we identified how the error had happened, that they had been replaced, and we made sure that it didn't happen again. So it's now been deactivated in all of our systems. It's not possible to order it. And so it is important to go back and re-audit these things and see, is there any non-formulary use that's happening? So it might seem like it was fairly easy, and it was, but then we did have a bit of a hiccup. The next thing we wanted to look at, we actually decommissioned our central nitrous oxide system. That one is easy as well. That one's a yes or no. In terms of being able to measure that metric. The difference with the nitrous oxide is there's not going to be any central nitrous oxide systems sneaking back in that once your system is decommissioned, it's very difficult to get it relicensed and going again. So once it's done, it's done. So we didn't feel we needed to audit again. The environmental impact of decommissioning our central nitrous oxide system, because of the inherent leaks in this type of system, is a 10 out of 10. There's no clinical impact to decommissioning the central system. We do still have small tanks available. The financial impact was positive because we no longer need to maintain this large system. And I gave it an easy factor of 10 out of 10, in that once it's done, it's done. But what needs to be considered is that it still took us 2 years to do it. And there was an incredible amount of effort that went into it. But because it is systems-based, we did give it a very, very high score. And now we're working on gloves. So what we're measuring is we're measuring our purchase data. The environmental impact is a 10 out of 10. So we actually had our IPAC team did an audit, and they determined that approximately 40% of our glove usage is inappropriate. So wearing gloves to talk to patients, wearing gloves to touch intact skin, and gloves are an impediment to hand hygiene. So IPAC has been an amazing partner in this. So we said the environmental impact would be a 10 out of 10. I'll give you some more meaningful metrics later on. In terms of the clinical impact, if you're not wearing gloves, you should be washing your hands more or sanitizing your hands more. So we expect this to have a positive clinical impact. Our definition of a 10 for financial is greater than $100,000 saved. There will be much more than $100,000 saved. And then is this going to be easy or hard? So I gave it a 1, being very hard. So this means that our 10,000 Sunnybrook employees who need to have access to gloves, who we want to wear them to wear gloves when it's appropriate, need to make the right decision. So you need to have 10,000 people making the right decision 8 or 9 times a day, all of them. So that is going to be very difficult. But despite the score being somewhat high, it looks as good as, your nitrous oxide and your desflurane. It will not be easy. I would not make that my first project because it's going to be a long haul. And I think we're ready to do that now. I think that we've got a few other projects under our belt. We have realistic expectations. We know what's going to be easy, what's not going to be easy. I thought nitrous oxide would take us about 2 months, and it took 2 years. So we're much older and wiser now. We have some other examples as well if you're looking at your formulary. So one of the examples, and I just kind of thinking about it in the context of what we do. So you might want to pick a product that you use a lot of and try and determine, is there a better option for that product? So we looked at low molecular weight heparin and our formulary choice for low molecular weight heparins. We have not made this change. We are looking at it and we're considering it. We looked at the packaging of all of the different products. And just within one molecule, there's about a 440 kilo difference in terms of the amount of garbage that goes to the landfill. It would have no clinical impact, no financial impact, and it would be fairly straightforward to do. So this is being considered. We also are, and that one ended up with a really easy number, right? Just a formulary change. We're also looking at the appropriate use in ALC patients, right? Where we'd have to do usage audits and annual purchase data. The environmental impact would be significant because we would be using low molecular weight heparin appropriately, and in some cases not using it at all. Clinical impact should be positive because we would not be giving it to patients where they don't require it. Financial impact might be slightly positive as well. We would be buying a little bit less. But in terms of will it be easy or not? So we spent many, many years getting prescribers to prescribe venous thromboembolism prophylaxis when it's appropriate. And probably when we were doing that, we probably had fewer ALC patients at the time. But now we're looking at this and we're trying to figure out, do we really need it in all of these ALC patients who, on the day they go home, nothing is really going to change a whole lot in their status? And could we potentially look at stopping it? But that will get a 1 because that's going to be very difficult. We have taken it on because we have a fellow who is interested in it, who's working on leading this project, but it is difficult. Some other examples. So keeping in mind that perfection is the enemy of progress. So most organizations have looked at their dry powder inhalers and they've looked at switching to it. It would be very hard in terms of behavior change to get everybody to switch off of using metered dose inhalers and switching to dry powdered inhalers. But as I mentioned, perfection is the enemy of progress. So what did we do? We did actually check, and thank you to Cascades for providing all of this information. So we were getting ready to look into, is there a difference between the brands of inhalers and can we find that? And Cascades already had this published on their website in terms of the amount of propellant in each brand of inhaler. And so we were able to look at that, ensure that our purchasing contract did include the brand, that instead of it being about 240 kilometers driven in a car, it's about 50 kilometers driven in a car. So it's about 1/5 the impact. And so that is a very simple formulary change. Nobody noticed that. That one was definitely got a very high easy score. And having worked for Alan Mills before, he knows how lazy I am and how I only do easy things. So yeah. And then you might want to pick something with multiple options as well. So we're also looking at our IV irons, and we're looking at the weight of the waste per dose. And we're also looking at the kilometers traveled for patients who come in for their intravenous iron. And the thing with intravenous iron is, well, we're trying to figure out what the environmental impact of the different ones will be. But depending on which one you choose, patients may need to return for one visit or 3 or 4 visits. And each time that they get an infusion, there may be a significant difference in terms of the carbon footprint, depending on which type of intravenous iron you're looking at. The problem with this is from a decision basis, if we made a formulary change, that would be that would be easy to do. But in our current financial situation, those IV irons that we expect to have a more positive environmental impact are considerably more expensive. And even when you factor in the different number of doses, they end up more expensive. So those are just some of the ideas that I wanted to talk to you about in terms of things that you can look at. Look at things where there are multiple options. Look at things you use a lot of, those things that you use on almost every patient, like VT prophylaxis, and look at where are there meaningful differences you can make there. Next, I want to talk about driving engagement using meaningful metrics. So at Sunnybrook, we use about 40 million non-sterile exam gloves per year. So that's the non-sterile ones. It doesn't include the operating room. And again, the audits showed there was 43% of the glove usage was inappropriate. So that gives us about 17.2 million gloves per year that we don't even need to use, right? So if you compare the gloves to something that means a lot more to us. So if you look, one pair of medium gloves actually has a carbon equivalent of 0.0277 kilos of carbon. So that means 476,000 kilograms of carbon equivalents. And this means nothing to me. I have no idea how big carbon is. It doesn't mean anything to me. So what we do is we translate things into things that mean something. So if you look at the gloves, that's approximately 7,878 tree seedlings that you plant, and then you allow them to grow for 10 years. So your staff can understand looking at the number of trees that you've planted a whole lot more than your carbon equivalents. So we thought that might be a meaningful metric. Another meaningful metric we looked at is we weighed a pair of medium size, because we figure that's probably the most common one, more nitrile gloves. Any of the pharmacists here can look at this and go, oh, she used one of the really accurate pharmaceutical balances, 6.877 grams, going out to 3 decimal places. And what does that mean? So if you measure that, we weighed a 500 ml empty Pure Life water bottle. We took off the cap, the ring, and the label because we're pharmacists. We want it to be really accurate. And that's 8.55 grams of plastic. And so if you look at it, our 17 million gloves is, or pairs of gloves is equivalent to 6,917,216 water bottles across all of Sunnybrook that we can save per year. Right. And we think that this is probably, we're bringing this to the frontline staff to ask them what is the most meaningful engagement metric for you. But we know that many of our staff intentionally do not choose water bottles, plastic water bottles. They choose a reusable one, like mine here. And that's almost 7 million water bottles a year. Like that is just, we really think that's going to be impactful, more so than the tree seedlings. So we're going to find out what's most meaningful to our teams, and we're going to use that as our anchor when we're communicating. And then, so yeah, is it going to be the trees? Is it going to be the water bottles? Is it going to be something else? We compared it to African elephants at one point in time as well, just to see what means the most. I can no longer advance my slides. I don't know why. Oh, there we are. Okay, I need to click on a different screen today. Nitrous oxide. Our central system was leaking 99%. Again, we can convert that to carbon dioxide. But where we landed at in the end, because nitrous oxide is, it contributes 75% of the global medical greenhouse gas footprint from anesthesia. We know that turning off our system is the equivalent of planting 22,000 trees per year and allowing them to grow for 10 years. And that's every year that we don't have that central system in place. So sustainable pharmacy in terms of leadership. So you can start big or you can start small, but you're going to want to start, right? 22,000 trees per year with nitrous oxide, that was really awesome. But actually, when we did the desflurane, we did that first, that was the equivalent of 176 trees per year. And I don't know about your sites, but my sites celebrate when we plant 200 trees. So don't underestimate the impact of starting small. Small is beautiful, but it's just important to start, okay? Perfection is the enemy of progress, and you want to measure something that is meaningful for your team. And thinking back to that desflurane, you want to keep track of things where there's a possibility for a backslide. We're really glad we thought we'll go back and we'll measure at the end of a year, make sure nothing happened, and sure enough, something had. So make sure there's no backslide. And that was it.